I want to see you guys all the way from Laikipia. Team Laikipia, eh? Wako wapi Team Laikipia? Laikipia?
At the moment, as some of us are still winding up on the environment issues, are joining right away.
Okay, we've had Laikipia. But let's hear from all the way from Niger. Pastor Weru, are you able to hear me and hear us well?
Yes, yeah, you're getting you well.
Karibuni sana, all the way from Niger. Are you able to put your video on? We see the students, the different youths and students at the university in Niger.
They are still entering.
So that the camera can focus on it.
Thank you. Hi, guys. Wow, welcome, Akina Mubarak. I have missed you guys. Hi, Susan. Karibuni. Susan, the translator. How are you doing? I'm also doing well. Today you'll be just translating because we are joined by all the universities. Karibuni sana. And welcome so much all the way from Niger with love, from Nairobi, Kenya. I choose Life Africa. We love you and value you. Karibuni sana. Thank you, ladies and gentlemen. Those are students from Niger. And we will be joining, South Sudan are joining, Tanzania are joining. So we are going, this is going big in the entire Africa. Ladies and gentlemen, now I know you are with the different students from the different university. Prince, are you able to hear me?
Yes, yes.
Can you switch on your video? Which university are you in today, Prince?
Right here in
Nice. I want to hear the students chant. Can you lead that, Prince?
give me
Okay, thank you, ladies and gentlemen. Welcome to today's session, all the way from Bomet, Nairobi, Machakos, all the University of Turkana University feel welcomed, and we value you so much. Right now, ladies and gentlemen, we're going to have two sessions today. One is on our sexual reproductive health module. The two sessions are one, STIs including HIV and AIDS, and the next session after STIs would be drug and substance abuse and mental health. They are two interesting topics. But before we do that, unlike each and every county officers, there is a link that I have shared in the university groups. Kindly, the county officers where you are, University of Eldoret, make sure that each still is able to access internet. I know Siwote, we have a smartphone. I'm also sharing the link with Pastor Erastus on WhatsApp all the way from Niger. Kindly help the students to fill in those. There's a set of questionnaire, and kindly the questionnaire, you are supposed to fill it as a student, and it's supposed to be an individual answer. Don't do it as a group. It's a survey. Kindly feel free to participate in the survey, and it's okay still if you feel uncomfortable, but you're not able to get your personal data. We won't be able to know your name or where you're answering from. It is a baseline tool to help us as we intervene today on health, to help us gauge where you are at in terms of the different KPIs around health and what we're trying to achieve. So ladies and gentlemen, the different county officers kindly ensure that each and every student has a link so that they can be able to answer the baseline survey. So Prince, are you able to share the link with the students group? Kindly, each university, make sure you have the link. I'm sharing one with Pastor Erastus from Niger. They can be able to fill the baseline tool in a few. So as we fill the baseline tool, kindly, if you have any question, you have your county officers on ground. You can be able to raise any question with the different county officers. Machakos University, mmetulia sana. Are we here, Machakos University? Machakos Mwaka.
The live session.
Sorry, Mwaka, I haven't heard you. Chakos seems they're having a problem or something. I'm not able to hear them. Team Turkana, is Turkana University represented? Turkana, where is Turkana? I can see them, they are present. Turkana University. The link is also shared on the chat box. Thank you, Prince, for helping me share the link on the chat box. I've also shared the link on WhatsApp with the team from Niger. I have been able to share the link. You have the link. So kindly take, right now it's 3:12. We are going to officially start exactly at 3:17. So kindly ensure that you are able to go through the set of questions. It's 100% voluntary. You can say you're not comfortable, that's okay. But I encourage you, this will inform the program. So it is very important to gauge in terms of data where you are at in terms of your knowledge and attitude on the same. So kindly, I'd encourage each and every student to feel free to fill in the form. No one is going to discriminate you or judge you in any way. In fact, there's no personal data as far as that is concerned. So kindly help us to fill that data. We'll be back. We'll have a short video on the SEALS program, and then I'll be back with after we've all filled, after we've all participated. Thank you. Welcome, ladies and gentlemen. Once again, thank you. Wow, I'm quite impressed in how the different universities have been able to take the tool or fill the tool. So far from my back end, I can see a total of about 100 students have already submitted their responses, which is quite impressive. So if you're winding up, kindly just wind up. Remember, at the end of the day, this is data that we are going to use it to inform the program. So kindly, Malaysia, if you're filling in Malaysia, please be very honest. No one is going to know you by name. So kindly, as you do it, be very honest. I can see them coming. 100 have already. We are at 103. Let's hit the target. We are about 180. So 103, we are still to go. The different county officers kindly help us to be able to ensure that majority of the students have filled the tool so that it can help us to go to inform the program as we move on. But how many are excited for today's session? I'll go now straight to today's session. We are going to have a very interesting session. As I told you as we began, health is one of our modules. Remember, this is a SEALS training, and we are looking at the different pillars that I Choose Life Africa will intervene around. We have sexual and reproductive health, education, environment and climate resilience, economic empowerment and employability, leadership and governance, and finally, safety and spiritual foundation. So today's, ladies and gentlemen, we are very privileged to have a very, very good friend of I Choose Life Africa. Her name is Jefflin Mwendwa. And Jefflin is a young guy. That's a good thing, because Sisi was we want young and identify with young people. Jefflin is a seasoned health practitioner. She's a sexual and reproductive health expert. And guess what? All the way from somewhere in Eastern Province, Kangundo Sub-County, working with the county government of Machakos. Ladies and gentlemen, help me welcome Jefflin Mwendwa to come and present a very interesting interactive session on STIs, including HIV and AIDS. I know, Jefflin, you'll be joined by students from Machakos University. And Machakos University, mnafaa kuwa na psych. This is one of you, this is one of your members from your county. I know you're very proud. So, ladies and gentlemen, wacha tupige hiyo psych tena. Then Jefflin will be here and will kick off the session. Karibuni sana.
Hi everyone, my name is Jefflyn and thank you for joining us to today's session. I am a healthcare provider working for the Machakos County Government, Department of Health and Emergency, where I coordinate adolescent and young people program. And I'm here today to take you through two sessions, but we'll start with the first one, sexual reproductive health, where our main focus for today will be sexually transmitted diseases. And to kick us off, maybe just to understand what is sexually transmitted infections or other diseases. And these are diseases that are transmitted from one person to the other. And please note, there should be a sexual contact for this part. So I'm aware that most of you are aware of different types of STDs, and there are quite a lot, but we'll just name a few. Maybe you can start with the common one like HIV, AIDS, which we'll be tackling later. We have gonorrhea, we have syphilis, we have things like chancroids, we have hepatitis B, and many more that we will be discussing for this session. And maybe to request, if you have a question, you can ask in between the sessions so that at least we are able to help you before the end of the session. So the most common ones, which are syphilis, gonorrhea, and HIV, and many things, remember they should be contracted from human being, and the person who should maybe contract you should be infected with these conditions. The key messages for today, as you can see in your screen, is that if you're able to protect your your health partner, and they will not get infected with these conditions. And we have different messages that we give to young ones. And number one is, please can you get tested? Because these conditions, they can be tested in our health facilities. And we have good behaviors that we advise our adolescents to keep. Number one is to make sure that they know their sexual status themselves first before getting a partner. Number two, if they are able to abstain from any sexual behavior, this would be the best method that one can prevent transmitting sexually transmitted diseases. And if they're not able, in event one is not able maybe to abstain, there's what we say, be faithful to your partner. If you are able to be faithful, that is also another good method. Remember, by this time, your partner will have been tested for the STI and you yourself will have been tested for the STI. So chances are, if you are faithful to your partner, you're not likely to transmit these diseases. In that event, if it becomes hard for you maybe to remain faithful, we encourage our young people to consistently and correctly use condom. Most of the challenges that we have with our young persons is that they use condom, yes, but not consistently and not correctly. Remember, there are ways on maybe how you're supposed to provide, maybe don on a condom. Some of our adolescents, they are maybe eager, they don't follow the steps, some don't even check things like expiry date. They don't even tear on the right places that we are advised to tear. So this is a very good thing that you should use the condom correctly and consistently. And the last thing that we advise maybe the adolescents to do, if you're not able to maintain the first 3 steps that I've guided, there are drugs that can now be used to prevent these STIs. One, things like PrEP and PEP. Yeah, they can be used for these conditions. And if I'm fast, please, you can let me know. So our objective for this session today, number one, I hope that everybody will be able to understand what is sexually transmitted infections, their symptoms, and how they increase one's vulnerability to health, or how they put you at a risk of contracting HIV. Number two, to identify the behaviors that increase the risk of contracting HIV. As I said earlier, you'll find that there are some of the behaviors that we do as young people that puts us at risk of contracting HIV, or rather, the sexually transmitted infections. Remember, not only HIV, there are many conditions just like I had mentioned. To repeat, maybe that can be shown on our screens, some of the examples of STDs that we have around, and the most common ones. We have gonorrhea, we have chancroid, we have herpes zoster, we have chlamydia, we have syphilis, we have HIV. Remember, the causes of these conditions could be from different agents. With agents, I mean, there are ones that are transmitted through a virus. An example would be maybe HIV. HIV is transmitted from one person to the other through the HIV virus, which is a viral infection. There are that are transmitted as well, as the agent being bacterial, things like gonorrhea. There are ones that are transmitted through parasites. All these agents lead to sexually transmitted infections. So, one would ask, after these definitions, how do I know that I have an STI? How would I tell that I have a sexually transmitted disease? How would I know that whatever I'm exhibiting are or could be the sign that I have an STI? And this leads us to the next slide that shows what are the signs and the symptoms of STI. As shown in our screen, what do we feel first? Remember, there are signs and symptoms. What am I likely to feel first? In your genital area, that includes the vaginal and the anal, you're likely to experience itchiness, or rather you feel like itching your genital area. This could be for both men and women. You're not limited. Also remember, for the men who have sex with men, our genital area by this time will serve as the anus. So the itchiness is not limited to only the vaginal orifice, but also the anal orifice. You will also experience a burning sensation when passing urine. You feel like your urine is burning, like your urine is hot when you're going to pee. This also is another symptom. And our concern is they could really confuse between sexually transmitted diseases and urinary tract infection. Remember, for the urinary tract infection, this is just a cause from maybe the infection at the urethra or the urine system. But for the sexually transmitted diseases, there has to be a sexual contact that now predisposed you to this condition. So, a burning when passing urine can be both a symptoms for both. And that is why we encourage that if you have these symptoms, it's good to visit a healthcare provider or a health facility so that at least they are able to differentiate of which conditions are you presenting with, because different conditions have different management. And the good thing is some are curable and some are not, but we'll come to see for the ones that maybe may not get permanent treatment, how do we live with them? Because we can live with them positively, like HIV. The next symptoms that you're likely to experience is pain in the lower womb, at the lower part of your abdomen, especially for women, which could show a sign of infection. Another symptom that you may feel is during sexual intercourse, pain. This also could be a symptom. Also could be blood in between your normal, for girls that is, could be blood in between, before your periods rather. You will also feel, for men, painful swollen testicles as a sign that they have been invaded and they have been infected. Of course, I had mentioned earlier, this condition would include syphilis, they include gonorrhea and many more. What am I likely to see? Before, I was describing what you're likely to feel as a human being. Now, what are you likely to see? Something that you'll use your eyes to see. Number one, a sore. Either could be at the penis, at the vagina, or any part that is nearby your genital area. There is also, you're able also to see pus that is coming from, maybe it could be coming from your penis or your vaginal area. At times, you're going to see the inflammation at the genital area, or what we call reddening, or the redness at your genital area. This is both for your men and women. Lymphadenopathy, or rather the swollen glands that are located at different points. You could be here, you could get some swelling where the lymph nodes are located. Lymph nodes are, lymphadenopathy is a symptom that an infection is already here and the white blood cells are really trying to fight the condition. And especially with infections. So the lymph nodes comes in to try and protect the body so that at least the bacteria or the virus or the parasite doesn't invade your body, and they act now as the guard. So during the process of now trying to getting that is where you get the swollen lymph nodes as they get attacked by the infections, or rather the bacteria or the parasites. There is also a heavy and a smelly discharge. Could be, there are some that can appear greenish in color. There are others that can appear pus-like, yellowish in color. But to note is, it will be smelly. Or you'll feel a foul smelling, smelly discharge. Disclaimer of the things that I've been talking about, we may want to see how they appear in images. And maybe we can project some of the symptoms, that signs and symptoms that are likely to appear, so that you can resonate with them. The first picture, you can see a discharge, which we can all appreciate that it's clearly not a normal discharge. It's yellowish in color. The next thing, this is a male genital organ. You can see the soles that are healing. They're not fresh soles in the second picture, but at least you can appreciate they are not normal. This is not a normal genital organ of a man. And the third one, you can see the inflammation around the genital area. Remember, for the ones that engage in oral sex as well, this can be transmitted also, and you can get some oral rash in your mouth. The same symptoms here, they could appear in your oral orifice. You could get some soles, you could get some foul smelling, and you could get some inflammation around your oral area, likely to present with what we call oral rash. The second images that we are going to see, you can see the lymphadenopathy I was talking about. The lymph nodes are really trying to fight the infection, and on the process, they got inflamed, and the swollen glands now are able to be visible, and everyone is able to appreciate that. You can see a fresh wound at the panel demonstrated here, that is septic. Sepsis is basically presents like pus-like. And at the testicle area, you are able to appreciate the wounds that surrounds the testicles of this young man being examined here. How am I able to prevent this? Maybe to repeat. Number one, counseling on prevention, or rather what we call safe sex behavior. How am I likely to live? Which are the behaviors that I should exhibit that cannot make me get predisposed to this condition? Number one, as I said earlier, is abstinence from sexual intercourse where possible. And it's good, it's possible. We've had a lot of adolescents abstaining from sexual abuse. If you're not able to abstain, and now you come here to our facility, that is, we're projecting the forces, there's what we call contact tracing for your partner. And this goes to our healthcare providers. If a young person presents to a facility with an STI, there's what we call contact tracing. We would want to know how many people did she or he have contact with. Remember what I said earlier? Sexually transmitted infections are passed from one person to the other. So you'd want to have trace this other person that you had a sexual contact with, so that at least we are able to curb on the infection. If you're able to do contact tracing, then you go to what we call condom promotion, or we encourage condom use, which is an effective method of family planning. One good with condom is it prevents one from getting the STIs. The second thing, it also acts as a method of family planning for people who do not want to get mistimed pregnancy, or rather what we call teenage pregnancy, or you could not be a teenage, yes, but you've not timed for your pregnancy that time. So it's one thing also to use a condom for both benefits. One, for prevention of STI. Number two, for prevention of pregnancy. And then we give you treatment. And for this treatment, if we give you this treatment, remember you have to be compliant to this medication. An example of a thing that can prevent an STI, especially HIV, is PrEP. How do you use PrEP, for example? PrEP is a drug that is used daily. That is for both male and female. You use this PrEP until you are out of risk. For you to be put on PrEP, it shows that the healthcare provider has assessed your risk, has clearly demonstrated that you are at risk, and you need now this drug to keep you from this risk. So you continue taking this daily oral PrEP until you yourself, you are out of this risk. A risk could be, number one, multiple partners that you don't know their status. Another risk would be what you call serial monogamy. Yes, maybe you don't have multiple partners, but you're that person who has one person for 1 week. The next week you have another person. Clearly you're monogamous, but in a month you have like 4 partners. Serial monogamy. Of all those 4 partners, you don't know any of their status. There's what we call transactional sex that we've seen with our young girls. Sex in exchange of something. And there's nothing as hard of what I've experienced in my line of career, like saying no or choosing a correct type of, choosing the way you'll have sex if you're doing a transactional sex. Because it's like, I'll buy what I want. I want you not to have condoms, so I just buy that. And it's really happening in our young people, or rather what we call intergenerational sex. They want to have maybe sex, but not with their age mates, with people who are older than them. That is where there were babas and were mamas. For the ones that come around our geographical setting knows, that is where they come in. I'll pay you for something. So if you have those risky behaviors, then we can put you on treatment. Remember, they are different type of drugs. If you have a bacterial infection, we are likely to put you on antibiotics. There is antifungal medication. There is different type of medication. That is why you cannot afford to manage STI at your home, and you need to come out to youth-friendly centers or safe spaces that accommodate the youth and have the youth at hand. Because most of the youths, they feel a bit shy, they feel a bit uncomfortable, they feel not understood when I come out and maybe say I have an STI secondary to an intergenerational sexual activity that I had with a whole person, or out of my multiple partners that I have, out of me being a young K-pop, a young maybe a member of LGBTQ community. So you need to come out to these safe spaces so that at least one is able to understand you and walk you through the journey, and also involve behavioral modification techniques that can help you modify the behavior that at that time they didn't fit to be good behaviors and maybe predisposed you to this condition. We have what we call complications of STI. What am I likely to experience if now I have an STI? They are short-term and they are long-term. Number one, they are chronic health conditions, including infertility, chronic pain on the pelvic inflammatory diseases. We have cancer, especially cancer of the cervix. To mention also is, cancer of the cervix is also a sexually transmitted disease. It is transmitted by a virus called human papilloma virus, that the carrier, most of the time, are men, that deposits the HPV virus at the cervix of the female and makes it a sexually transmitted disease. So at times also, multiple partners can predispose, can make you at a risk of contracting cancer, especially cancer of the cervix. There is a presentation that looks like acute psychotic syndrome, especially with complications of syphilis. You start presenting like you have psychosis, or rather a mental condition. This is a complication, especially of syphilis. For things like HIV, ideally, the complications of HIV, or rather what we call opportunistic infections, they come in when now your viral load goes down, and you can get complications like meningitis, you can get complications like herpes zoster, you can get complications like TB. Remember, by this time, the immunity has gone down and your body is being invaded now by the viruses and the bacteria and everything. Remember, STI also can be transmitted from mother to child. A good example that we'll be discussing maybe later during the HIV session is HIV. That can lead to lower birth weights, getting your child prematurely, or increased dangers in maybe delivery as well. So, to proceed on to HIV, which is now a major component of STI, doesn't mean the others don't really count, but why are we struggling with HIV as a nation and globally? Maybe for the Kenyan statistics, we can appreciate that 41 of new infections that are coming, of all infections are coming from adolescent and young people. That is from 10 From 15 to 24, we are contributing, in Kenya, we are contributing to 41%. If we were to look at the extension of 35 years where a youth lies, we'll contribute to 73% of the HIV new infections. What does that tell us? The major contributors of HIV for our nation are the young people. And we cannot keep quiet about this data. We all appreciate that data do not lie, and it is time now we come out and talk about it as a nation and also globally. And maybe we could project the data that is being, and appreciate that almost 1.3 people live with HIV. And remember, with HIV, an adult, we know it's contrary to the Constitution of Kenya where an adult is 18 years and above. But for HIV, we include testing of an adult who is 15 years and above. We say that a 15-year-old person and above can give consent to HIV testing, care, and treatment. And clearly this shows, that is why we are able to pick these numbers. We also, as a nation, would say that we've started the sexual debut as early as 12 years, 13 years. We have even 10 years getting pregnant, 11 years getting pregnant. This is to show that our young people, or rather our adolescents, are having sex, and we need to speak. We need not come out and discuss what is it that we have to do differently as a nation. So, definition of HIV, or rather, what is HIV? HIV is human immunodeficiency virus. HIV is just a virus, and most of people who have no complications live with HIV virus positively. They don't have to get complications so long as they've maintained their viral load. And what is viral load, or rather kinga ya mwili? These are the askaris, or rather the police of the body that take care. The white blood cells, they take care of your immunity. So when your viral load is high, you're likely to get immunocompromised. Your immunity goes low, extremely low. That you get to a risk of now getting other immunocompromised diseases. Like I had said earlier, that is HIV. There is meningitis, cryptococcal meningitis. There could be TB. There could be pneumonia. Anything else that is not real, that is associated with HIV. So, how do I keep maybe my viral load? Assuming I was born positive, and I appreciate most of our adolescents that were born positive. They've lived positive with HIV, they've known their status, and they've taken charge of their own health to protect themselves and their partners. How do I now maintain my viral load? The desirable viral load of every person living with HIV should be at least a viral load of below 200 copies per mil. If you live with this, at least you'll say you've lived in the desirable levels that we want. A new phrase is coming in where we've started introducing what we call U is equals to U. U is equals to U is a HIV prevention strategy aiming in destigmatizing, because there's still stigma with the HIV, aiming in destigmatizing the HIV. U is to U champions, who I appreciate so much, know that for them to be champions of use to you, their viral load has to be below 50 copies per mil. It is said, science has proven that if they are below 50 copies, if their viral load is below 50, they cannot transmit HIV, but please note, sexually. Not in any way, they don't need to transfuse blood, they don't need any other method, but sexually. They can marry a negative person and do not transmit HIV. They can have HIV negative babies, and they can live a long life. But please note, for US to you messaging, you have to maintain the viral load, or what you call durability in viremia. You have to make sure your viral load is usually 50 mils per copy forever. It's not one time 50 and then up, 50 up, no, for your viral load, because that is where the myths and misconceptions are coming, especially with young people. You have a partner, this time, yes, you are suppressed, you are LDL, you are an U is to U champion. The next time you're not suppressed. So you pose the danger to the partner that you are having. So if you have to be a U is to U champions, please maintain the viral load has to be below 50 and durable, at least for more than 2 times you've maintained the U is to U. Because I know our myths and misconception and where we are getting wrong as a young people is not knowing the cut line of this viral load. If you are dating someone who is HIV positive, it is good enough you get disclosure from them so that at least you can help them in supporting, in treatment support, so that they're able to know, how am I going to take my medication? How am I maybe going to maintain my viral load and be an used to you champion and maybe protect you, protect my family, and protect the society at large. But the good thing is, for the used to you champion, they are able to live a normal life. They are able to marry negative partners. They are able to have negative babies, and it has been proven. That is why we are here advocating for it. So it switches to AIDS. What is AIDS? Acquired immunodeficiency syndrome. Rather, a complications of HIV. In event now you didn't follow this guideline that you've been saying. You didn't take your medication well, or if you took your medication but took a drug holiday, came back, you're not adherent to medication, hauku unafuatilia masa. If for the HIV conditions, if the drug should be taken at 8, we insist that the timeline should maintain. So in event you keep on switching from this time to the other, your viral load is likely to fluctuate. And you're likely now to get what we call acquired immunodeficiency syndrome. And this is what now complicates. This is where the complications come in. This is where you start now seeing these signs and symptoms. So, how is HIV transmitted? As you can see in our screen, the transmission mode of HIV, number 1, is unprotected vaginal and anal intercourse at 87%. Remember, for the MSMs, or what we call men who have sex with men, they are likely to be more predisposed, or what we call the prevalence is high because of different anatomical design of their body. An anus is not likely to be as maybe lubricated as a vaginal at different times. So they pose a risk at times of maybe having lacerations during their sexual intercourse. So if you are a young man who have sex with man, you should know at least that your partner should get tested, and how well do we make the sexual activity a bit safe. Similar to women, as I said earlier, vaginal and oral. And maybe to clear some myths is a kiss may not bring about HIV. For the people who keep asking, if I kiss someone who has HIV, am I likely to get HIV? No, you'll not get HIV. But remember, this person should not be maybe having things like oral thrush or maybe a cut, but just a normal kiss at suitable conditions, you're not likely to get HIV. Another means of transmission that is shown in our screen is mother-to-child pregnancy. And to clear the air is U is to U that I had talked about does not apply for mother to child. we cannot assume that U is to U. Science has not proven that you cannot pass viral load through breastfeeding, through delivery, if you are U is to U. So if you are a mother who is pregnant and living with HIV, you have to take all the precautions that are given, all the guidelines that are provided by the MOH, so that you can take care of the unborn child, continue up to the second year when the child rather gets discharged from the EMTCT clinics, or what you call the elimination of mother to child clinics. So for the ones that live with HIV and are women, please note that U is to U does not apply. The third transmission is blood transmission of an infected person. Remember, for all the STIs, please, everybody should be infected. If you're not infected, then you'll not be able to pass it. So if you had a blood transfusion, though such is rare, we have good screening in our health facilities. Such is rare. Do not panic when you get transfused blood. Maybe you have other conditions. Do not panic. All of the health facilities are able to screen the conditions well and sieve all these conditions. Contaminated needles and sharps. Do not share sharp needles. Do not share sharp glasses with someone. If they are infected, and remember, U is to U do not apply for this. I said earlier, U is to U is only for the sexual intercourse. If you share these needles with someone who is infected, these sharp things, you are likely now to contract the HIV disease. So, again, what are the predisposing factors of HIV? What is likely to make me predisposed to HIV? As a young man, a young woman, a young girl seated somewhere, what is likely to make me? And maybe to pose a challenge, how many of us know our status today? How many of us know the status of their partner or other partners today? You can have that as a challenge, and when you finish this session, maybe you can tell your partners to disclose their partners, their status, and you'll be surprised that some don't know. Some have been positive, some themselves are positive and they don't know. So what are these predisposing factors, or rather perpetuating factors, that can lead me to an HIV infection? One, multiple concurrent partners, or what I said, they could not necessarily be multiple for that time, but serial monogamy. For a week, you change. A week, you change. A week, you change. So in a month, you have 4 partners, which is similar to multiple partners. Number 2, stigma and discrimination. It is true that there is still stigma for the people that are living with HIV, that we just assume that maybe they got it out of maybe irresponsible sexual activities, yet it is not. I have a couple of adolescents that I lead, that I admire so much, and most of them were born with HIV. It's not their fault. What do I do when I was born with HIV? How am I likely to live if I found myself today in HIV? Do we live with them positively? Yes, they are living positive. But how can we help you? And that is why we are here to champion for things like U is to U, so that at least they know they are able to live a normal life just like you. And to put it across that they don't need to believe that they need to die because they were born HIV. There are other measures that we can put in place to have them live and forever. So we don't need to discriminate our peers who live with HIV. You can share with them a spoon. You can share with them a plate. You can share with them a bed. It's not likely to transmit HIV. Do not stigmatize them in any way. Give them psychosocial support that they require. Gender-based violence. And gender-based violence is one of the triple threats that we are dealing with globally. Number 1 is the new HIV infections that I've talked about. Number 2 is gender-based violence, where sexual abuse is linked to GBV. Most of the perpetrators do not know their status. Most of the victims have turned out to be HIV positive after they were being exposed to sexual abuse. So we encourage that for every sexual abuse that has happened, please can the victims, the survivors, can they visit the facilities as soon as they can, where possible, before 72 hours, so that at least we are able to prevent now HIV. There is a very thin connection between HIV and GBV. If you've been abused today, sexually abused that is, or even physically you've been bitten, you've been assaulted and there's a cut somewhere, you're likely to experience a trauma. And through this, you can contract HIV. So our message today is that for every gender-based survivor, we want them to know that we appreciate them for coming out and coming out clearly to seek justice. And one of the justice that we should give as healthcare providers is treatment, including HIV prevention, teenage mistimed pregnancy that they didn't want by that time, different infections, not necessarily HIV, bacteria, parasites, and everything. Another predisposing factor is economic status, especially for the youths. And this is what is leading to intergenerational marriage or intergenerational relationships. A young girl would not want to have a young boy for an intimate partner and rather prefers an old man who is likely to provide money. In events, the old man has multiple partners because he's able to afford. Or an old woman has many young men. She is able to provide anyway. So the economic status of our youths. Most of our youths also do not want to get tired. They want the easy thing. And of course, easy thing, and you get contracted with HIV. And then we have the STI history, and this comes out to a youth somewhere. If you've had an history of STI, maybe you had gonorrhea and you're not tested for HIV, it's a wake-up call. These things are connected together. So maybe you'd want to know where I got this STI. Is there a likelihood that I could have contracted HIV by this time? Also for the healthcare providers, if you experience a young person, or just any person, remember the old person also, their partners are young people. Any person with STI, do not let them go without testing for HIV. That could be a missed opportunity. That could be a predisposing factor. So as you can see in our screen, there are what we call the risky and non-risky behaviors. Number one, have sex with more than one person. I had said that. Or different persons, different people, but under a very short duration. Number two, I or partner has had an STI in the past. Number three, you share a razor with a person with HIV/AIDS. Number four, only have sex with one partner, but maybe you don't know their status. Non-risky behavior, live, work, or play with a person who lives with HIV. That is not a risky behavior. You don't have to fear. Then do not know if the sexual partner is HIV positive or has an STI. If you don't know, that is a risky behavior. You should get at least aware of the status of another person. Have an injections, tattoos, or piercing. And the instruments that are used for this, maybe they're not sterilized enough. We encourage to have new devices, or rather new equipment for these conditions. To repeat, HIV prevention, we say it's A, B, C, D. They are just 4 strategies that are used for prevention of HIV, which is also an STI. Number 1, I said abstaining. If you're able to abstain, you're not likely to get an STI. The second one is being faithful. If you know the status of your person, please be faithful. The third one, correct and consistent use of condom. And the last one, a drug that could be availed, that is PrEP, PrEP, and many more. So, to wind it up is that there is a problem, and we have to appreciate that there is a problem with STI, and most of our young persons are not taking care of their sexual reproductive health. And it is time we put this together now as a nation and see how well are we going to address these things, especially for the young ones, so that at least we are able to have a safe nation, a safe youth, safe adolescents who are going to take care or take charge of their health, protect themselves, protect their partners, and protect the future of these nations, both here and globally. Thank you, and I welcome your questions.
Individuals take.
So maybe to take this question, I hope I'm audible enough. What action should individuals take if they have used condom from the recalled batch of Sure lubricated dotted condom? Yes, I agree. There's the batch that came in and it had an issue. A minute, as I said this. I would advise that you visit the health facility so that you are able maybe to for your psychosocial support as well. You should visit the facility so that at least we are able to guide you on that. Does male circumcision have any impact on HIV/AIDS prevention? Yes, please. Prevalence in circumcision is, for the ones that are not circumcised, we say that prevalence is a bit high. So we encourage as one of the strategy that one should get circumcised where possible. Francis Ndungu is asking, how many hours should one take PEP or PrEP to prevent getting HIV? PrEP should be taken so long as you are at risk. So long as you know the behaviors that you are exhibiting at that given time, they put you at risk. For men, there is what we call event-driven PrEP. I know it's a new update, but maybe just to give. For event-driven PrEP should be taken by only men, with all due respect to the LGBTQ community, the men that are born men at birth, pronounced men, not female who maybe exhibit behaviors that look like a man. So for the event-driven PrEP, we give you 4 tablets. Please be keen on this. We give you 4 tablets. The first 2 tablets, you take them in the first 24 hours and at least 2 hours before the sexual intercourse. So you have the sex during the 24 hours. You take 2 tablets, wait for 2 hours, have sex in between 2 and 24 hours, and then no other event of sex should happen. Then you're going to take 1 tablet after 24 hours and 1 tablet after 24 hours. That is just the event-driven PrEP and should be used for men. For normal PrEP is so long as you are in danger. So long as you feel you are at risk as a person, that is when you take PrEP. For men, it's likely to be immediately. But for female, you'll wait until the 7th day. That is where now you start, we say the efficacy of PrEP has started. For PEP, please should be before 72 hours. PEP is post-exposure prophylaxis. The exposure has already happened. There's nothing you can do. It has happened. So you have to prevent yourself before 72 hours are over. In case I'm not clear, I'll repeat during the next session. What health risks are associated with using defective Sure condoms? There is no risk associated with Sure condoms. They are good condoms. We have them under PEPFAR programs. We have them in the Ministry of Health, and we can attest that they are good condoms. So do not feel worried that you're using Sure condoms. Be rest assured that they are good condoms and they are likely to serve the same purpose. I don't think there is any other question. Oh, there's a lot. Someone is asking about the photos that were circulating about super gonorrhea. Yes, still gonorrhea is there, and you should take charge of our own health and use the precautions that we've been talking about. The dangers of having viral load, high viral load, is the opportunistic infections that are likely to get you due to the high viral load in your body. Remember, the more the viral load, the lower the immunity. So your body will not be able to take, to prevent you from different conditions, and your immune will be very low, such that you'll not be able to live a healthier life for a long time. From Bomet University, how does early diagnosis and treatment with antiretroviral therapy, ART, impact the health and life expectancy of people living with HIV? A very good question. We're in the era of tests and treats. If you get tested today and you want to start today, that would be the best thing. The earlier you start it, the better, because you don't give your body chances to be attacked by the viral load. So your CD4 remains high. Remember, in HIV, there is what we call CD4. We want your CD4 to be high. CD4 are the healthy cells of our body. We want them to continue being so high and the viral load to be so low. So when you start the ART, or rather the antiretroviral therapy medications, the viral load stays low and the CD4 stays high, such that now you don't have to get the opportunistic diseases. So the danger, Thomas, is if you don't start early, you get these infections, and now the viral load goes high and you get the opportunistic infections. Someone is asking the best alternative for contraceptive going forward. Now there is a shortage. If where you coming from there is a shortage, there are natural method of family planning as well. There's what we call withdrawal method. It's a natural method. If you are only able to do it, if you are good at it, there's what we call safe days that needs a lot of guidance. So I'd encourage for the youths who maybe would have experience with shortage from different parts of the counties, would first want to visit the facilities and affirm it's true there are shortage, because we've been having commodities from MOH, but if you have shortage, you could maybe consider having different types of natural method like safe days, there's withdrawal method, or long-term solutions like IUCD that can take you for a longer period, and still a good method of family planning that you can have for 10 years. And at an event as a young person, if you want now to give birth, you can just have it removed and your return fertility just is the same, just is immediately rather. So you can consider the rest. And also condom. Remember, condom is also a method of family planning. I don't know. I don't know if I've missed any other question. I can't see any other question. Someone is asking, for benefit of doubt, how sure is use of condom aiding in protective STI? Be sure that if you use condom correctly and consistently. The issue is correctly. Most of our young people do not use condom, yes, but not correctly. For example, most, I don't want to say all, but most don't even care about the expiry date. Most don't even feel the fluffiness in a condom. Most tear at night when the lights are not on. So they're likely to maybe have it not in a good condition, and you're likely maybe to link it to not being effective. But be sure that condom is an approved method of family planning that can prevent both STI and a pregnancy. You don't have to fear. If only you use it well and correctly and consistently. Someone is asking, are there risks of some prevention? For example, some are allergic to various contraceptives. I'll say different people react differently from different contraceptives. It is wise enough, it is prudent to visit a healthcare facility so that you and your healthcare provider can discuss on which best method you need for family planning. Remember, something like IUCD needs your uterus to sound, or rather to fit in good sizing. So in event maybe your uterus is short and is not able to contain the IUD, it's likely to flip off at a given time, or maybe get it displaced. There are things that you need to consider, like weight, maybe weight of the client using this, any chronic condition that maybe this person would be having, and different factors. So we would say, if you want to start a method of family planning, you should visit a healthcare provider so that at least they are able to guide you on which best method is this. Things like depot, yes, they are good family planning method, but they delay fertility in some clients. So we wouldn't want to encourage maybe an adolescent use that method as a first option method for family planning, because we understand at one given time you'll want to give birth, and what will happen. So can we have this meaningful discussion together so that at least we guide you on which is the best way? For nulliparous, people that have not given birth, people maybe who have one child, people who have two child, people who don't want to get children again, different family planning for different people. That is Anthony from Machakos, and hi from my county. How effective are the current medical intervention in preventing HIV transmission from mother to child? I would say we are still struggling as a nation, but the intervention here are working. So all the interventions that are in place, they are working, if only you follow the intervention. But remember, I wouldn't say we are not doing so perfect as a nation. So we need to keep on getting better, especially the issue of disclosure. Many adolescents and young people living positive, they don't like disclosing their status to their partners when they get married. Of course, that makes it a bit hard for them to swallow their medication because their partners don't know. And if they get pregnant, they stop swallowing the medication, they predispose the young, the infant to HIV, and now we keep on now again struggling with the condition. If you have challenges with family planning, please can you visit a health facility so that you can discuss with many. I see chats are coming in, and I want to appreciate you so much for being an attentive audience. I hope I've been able to reach most of you or all of you. We have our social handles for if you want to follow us for these questions. Please, you can follow us on Vijana Tubonge Health. We will be sharing with the ICL. You can also follow up from your county leads where we coordinate. We are part of the team that works closely with ICL, which is a good organization. So in event you are from ICL and you want us to have a session physically, we are here to provide that. And so that at least you can get a better youth and a good nation. Thank you very much and bye-bye.
Welcome back, ladies and gentlemen. We are pleased to have you here. We'll take you through this session on drugs and substance abuse and mental health with our very own Jefflyn. Jefflyn is back. I know she's a very interesting facilitator, generally everything to do with health. So we'll be discussing sort of drug and substance abuse. And most of you are university students. These are issues that we are facing. Of course, drugs are in our universities, and data, again, does not lie because we have the data. So on today's session is on drug and substance abuse, and the purpose of this session is for you to help you to identify the risky factors and preventive factors associated with substance abuse, that is drugs and alcohol. And for this session, we have 4 main objectives that we want to accomplish. That one, to you to learn about the different drugs that we have in our universities. The second one is for you to identify the risky factors and preventing factors associated with substance abuse, that is drugs and alcohol. And the third one is for you to discuss what addiction and its consequences, because we all know very well, even 4th year, 3rd year, you may had a friend, and along the way in school, they were hooked up on addiction, and right now they are drug addicts, and we have numerous stories on the same. So we'll be looking at addiction as one of it. Then finally, for you to determine the behaviors that increase well-being and allow you to achieve your goals as far as drug and substance is concerned, because we all know we are not here to tell you it is bad or it is right, but we are here to equip you with the information for you to make a decision. At the end of the day, we say we are here to improve your life opportunities as I Choose Life Africa, and for you as a SEAL. But at the end of the day, for you to be able to make your own decisions as a young person. So we have a key message for this session, and we say, take personal responsibility. Don't let drug and substance abuse rule your life. Repeat after me. Take personal responsibility. Don't let drug and substance abuse rule your life. That's a key message we want to put across the different universities, even in Niger, Tanzania, and South Sudan. If you're joining us, you are the person to take personal responsibility of your life. And now we'll be discussing a lot, and I know Jefflyn is quite eager to take us through what we'll be exploring differently. But I have a question before we go on. I have 4 questions. Number 1, do people use drugs in your university? I know it's a hypothetical question. Do they? We'll be hearing from the different universities. Where do we access the drugs and substance abuse in your university? And which is the most abused substance or drug in the market? Then number 4, which drug or substance abuse is big? It's a big thing now for the youth in your university. Now, I'll start with, let me start with Machakos University. Anyone from Machakos University? Anyone from Machakos University? Yes, Rogers. Rogers, you can unmute, Rogers. Rogers, can you hear me? Rogers? Or any other person from Machakos University? Who else from Machakos? Okay, let me know. Let me go to Wasing. Okay, we have Kipchumba Dennis.
Okay, so the most misused drug is bank. Yeah, so I can say then the people who maybe give these drugs are our fellow students. You find them there. Some are pedis. Then I don't recall the last question, but bank compared also to alcohol, bank is mostly used. Yeah.
Bang and alcohol. Just hold on there, Kipchumba. Then which drug of substance is big. You've told us drug and bang. Then the most abused one is drug, again, bang and alcohol. And where do they access? You've told us from your fellow students, but where? Tell us more about that. Dennis.
Ian, are you muted?
Oh,
You're muted, sir.
I'm muted.
Yeah.
Sorry about that. I'm back. Yeah, Kipchumba, I'm asking you, where do you access the drugs? Where do you get the bang or the alcohol? Kipchumba from...
Okay. I said
Yes.
we acquire these drugs from the nearby, mostly our students, our fellow students, and also the community people, the young people who are not at schools and they are just hanging around the institution. So those are the two main pedis, I can say, around our institutions.
Okay, thank you, Dennis, for that. So you have bang and alcohol in Machakos. The community around the young people get the drugs from them. That's quite informative. Let's go to Nairobi. Nairobi, anyone from Nairobi, University of Nairobi? What are the most abused drugs in the University of Nairobi? And where do you get from? Where do you get the drugs from? University of Nairobi, someone?
Yeah, we have a guy here. All right, so hi guys, this is Nixon Soita from the University of Nairobi. So at the University of Nairobi, the most misused drug is definitely cannabis, followed by alcohol. Those two are the major drugs here at the University of Nairobi.
Okay, so where do you get or where do you access them from?
Well, we have suppliers around.
You just sounded like they're given a tender.
Yeah, so mostly they are within residential areas where comrades live, or even some students themselves are supplying for other bigger suppliers.
Oh, okay. So what are the local names for those drugs? For example, cannabis. What's the name given to such a drug at the University of Nairobi?
Okay, at the UN, we cannabis goes for guai, ama blunt, ama shash, ama foreign. Those four are the top.
Hey, okay. So foreign, guai. Hey, okay, sawa. I'm an alumni, but I'm not. During my times, I don't think we had that. But yeah, foreign, I'm not so sure what you mean. But yeah, those are the different drugs in the University of Nairobi. It will be interesting for us to hear from Niger, because we may be sitting here thinking Niger is a holy country. Let's hear from Niger. You can unmute.
Yes, we have unmuted. Lois is going to say.
Okay.
Shisha is the most major. Shisha.
Oh, shisha. Okay, shisha. That's very famous even here. Another one. Cannabis is grown in Niger. Okay. That's another one that I'm seeing very famous. Cannabis, and they've mentioned University of Nairobi and Machakos also have cannabis. Oh, cigarettes. Oh, okay. Tobacco. Okay. Now, it will be interesting. Sorry?
Somebody is saying tea as
Okay. We'll be learning more on that. Of course, coffee and, we'll be told about the stimulants and the rest. So right about now, let me not ask the different counties, but I know you can write on the chat box. Kindly, if you're from Laikipia, Bomet, if you're from University of Eldoret, Turkana, kindly write on the chat box those drugs in your school, where they are found. Feel free to use the chat box to give us more information on the same. Remember, we are a behavior change program. Feel free to share with us information. We are not NACADA. We are not the police. We are here to work with you and give you information so that you can be able to improve your life opportunities. Right about now, you know me, I was just introducing, but our very own Jefflin has the content and she's ready to tell us more about drug and substance abuse. So, ladies and gentlemen, again, help me welcome Jefflin to continue with the session. I'll just be here listening and also participating with you as we go on with the session. Thank you, Karibu Jefflin.
Thank you, and thank you everybody for having me back. We've shifted gears now. We are in mental health, which is a very dear topic to me, and specifically drug and substance abuse. And having been interacting closely to the adolescent, yes, I understand Ngwai, Kiforen, Shisha, Ndom. So feel free to ask in any language for my own geographical area and of course for the rest. So to start off, what is a drug basically? Why are we here? And how do we define a drug? Number one, would say a drug is any substance. Number one, should be a chemical substance that, when taken, alters or rather changes your physical and psychological effect. So it has to change your physical. Physical is how you do physically. For example, have you ever wondered why person abusing alcohol staggers? It is because the motor activity, or rather the physical coordination, has lost. So, are you able to hear me now? As I was saying, sorry for that. As just defining a drug, and I said, a drug is a substance, should be a chemical substance first, that when taken is able to alter both physical and psychological changes in your body. Physical is what you're able to see. A drunk person takes, when a drunk person takes beer, the physical changes happens. He starts staggering around, the posture changes, he steps maybe some steps mbele and then backwards, because everything, the coordination has lost. Psychological. Her or his thoughts changes. How she thinks or he thinks about things changes. And then it can be used interchangeably with the word substance. Maybe to make you understand what is a substance that we get in a drug, so that you can able to appreciate what is a substance. For example, a drug like caffeine, a drug like in tea, we look for caffeine. In marijuana, for the guys who are saying Kiforen, Shash, Ndom, the drug, yes, is marijuana. The whole of it is marijuana. But what is the substance that you're looking for? What is the substance that makes you now feel high? For maybe things like marijuana, the substance we're looking for is tetrahydrocannabinol. For things like amphetamine, Jabba, Mira, the things that we're looking for is amphetamine. So when we'll be discussing with you during this topic, we want to understand what is this drug you're taking and how does the substance affect you both physically and psychologically. This is what we call dependency. Dependency is where one functions normally when high. You're not able to do any other thing. You're just dependent on this drug. And then there's an addiction. Addiction is where they are reversible symptoms that appear when one is abusing drug. For example, alcohol withdrawal, you're likely to have tremors. You're likely to hallucinate. You're likely to have maybe someone sweating, feeling a bit withdrawn, and different things. There's what we call tolerance. Tolerance is for wale watu, those people that used to take 2 beers and they're done. You just find yourself, why am I taking 5 and nothing happens? Why am I taking, for the ones that come in Kenya, the mzinga thing, and I can walk home? You're just becoming tolerant to the drug, which is a dangerous sign to us. So in our screens, you are able to appreciate different type of drugs. The first one is alcohol. There is also the injectables that we'll be learning later. There is a picture also of on cigarettes. There is some tablets that we can see down there. We'll be discussing them. The second picture is the cannabis, or rather the marijuana. This is a whole picture of marijuana. That is where we'll get the tetrahydrocannabinol molecule. And then we have Mira. Mira can come in both Mira and Jaba. So our substance here will be amphetamine. We'll be really keen to know, what does this substance do to you? So we have 4 different types of drugs. Or rather, different drugs are many, but for learning purposes or for teaching purposes, we classify our drugs into 4 types. Number 1 is what we call the stimulants. The stimulants, just like their name, they are likely to stimulate your brain and your body. A good example is Mira, Jaba. Have you ever wondered, why does someone does extraordinary duties while high on Jaba? They're likely maybe to wash their clothes at night, even farm at night, walk around, say a lot of stories, because their brain is stimulated and every part of their body is stimulated, including the sexual activities. For the youths that abuse marijuana, they'll tell you that the excitement that comes with it, they continue with even the sexual intercourse will last a bit longer, but doesn't mean it was exciting for them at that time. Remember, there is also sexual disorder. There is what we call depressants. Just like the name, they depress the brain. An example is alcohol. That is why alcohol makes you sleep. At extreme times of alcohol intake, you get to doze off, or what the University of Nairobi, Machakos, wataita kubleki, because you've depressed your brain. It doesn't work anymore. You've blaked, you've shut down. Another type is what we call the opioids, or rather the narcotics. The narcotics are the heroin, basically the hard drugs. Heroin, morphine, they are very accessible, especially in our health facilities and over-the-counter medications during pharmacy. They also depress the CNS, the central nervous system, at different points. And they are very addictive. They are drug of addiction. And the last type is what we call the hallucinogens. Just like the word hallucinogen, you are likely to hallucinate when using them. An example is marijuana, which is a common drug abused all around. That is why people will tell you, like, they start seeing their things. And things by that time, it was an hallucinations. Remember, hallucinations, it's an interpretation of a false subject, a false interpretation of an object. You start hearing your own things. You start seeing your own things. You start feeling your own things. If you have withdrawal, you are hallucinating. You could also get what we call the illusions. You start seeing the real object, but in a different interpretation. You see someone, but doesn't look like a real human to you by that time. Yes. So maybe back to you, Ian, so that I had to find the drugs and the type of drugs that we have, so that at least we may continue.
Okay, thank you. Thank you, Jefflyn. And this is a quite interesting topic, because I could see on the chat box the students are writing some of this, the comments that are coming. So I can see Bomet, Kishash, Mira, and Bang that are the most commonly abused drugs in even Bomet. Kindly feel free, continue writing on the chat box. We should be able to get the feedback. But now, as you've been taken through the different types of drugs, what are the different risk factors? Because at the end of the day, we are here to empower you with information, and you'll see at the end of this presentation, there'll be a roadmap. And we cannot force you to go on a certain lane. You'll be able to make a decision as a young person. Is this the route that I want to go? Is it the route that I don't want to go? But ours is to equip you with facts and knowledge about the topic. So there are different risky factors as you can see in your screen. But before they are projected, just a minute, I want to ask a student from University of Bomet University, what do you think are some risky factors when it comes to drug and substance abuse? What do you risk? And maybe I'll just be very specific. I'll ask Nancy David from Bomet University. What do you think are these risky factors, or some of the risky factors when it comes to drug and substance abuse? So, Nancy, can you hear me? Nancy, can you hear me? I can't hear you. I can't hear you. You're very far from the mic, Nancy. Very far, very far. Just come closer to the mic very fast. Yeah, you can just say what she's saying if you're closer to the mic. Yes? Okay. Let me ask a different university. Laikipia, what are some of the risky factors when it comes to drug and substance abuse? Laikipia University or even Turkana, either. Just unmute and speak. Anyone? Watu leo wataki kuongea. But it's okay. I'll continue. So we have some of the risky factors when it comes to drug and substance abuse. And mostly these have to do with the risk factors and the preventive factors. So some of the risk factors when it comes to drug and substance abuse include family members who abuse drug or alcohol. Some of you have been brought up in homes where alcohol is readily available. So that becomes a risk factor because when it is there and you may be left home alone as a teenager, you're tempted to try. So that's one. Then involvement in substance abuse at an early age. You started perhaps when you're in high school. Most of the drug cases start in high school when you're a teenager. When you're going through high school and you're lured into drugs, peer pressure, you're told for you to be a cool guy, lazima uvute, kishash, kiforeign. So some of these things begin at that stage. Then when you are physically abused or trauma, some have gone through trauma, which Jefflin will be speaking a bit about mental health. Then you are unclear about the different rules at home, at school. You try to do this, wanakuingililia. They try to tell you you're just under pressure as a young person because you're very unclear of life. You're very unclear of what life will become. So some of this pressure, you get lured into drug and substance abuse. Then there's peer pressure, which is number one, I think, according to me, when it comes to drug and substance abuse. Because people just start among your peers, they start doing alcohol or taking cannabis, then you're lured into it. So that's a risky factor. Then conflict between family and friends, bullying, low grades. Actually, this one in high school, people are saying if you smoke cannabis, you become sharp, you get more. So people, if you're failing, you're told, just take this, then you'll become bright and all that. Then early antisocial behavior. There are people who are so introverted to an extent that they live like sort of wild animals, which is not healthy as a human being, because you have the social aspect of your life. Then you have school-related pressures. You have pressure to perform in school. You're not performing. Your parents are giving you a lot of pressure. So those are some of the risky factors. And then we have preventive factors. How can you prevent this? Then prevent drug and substance abuse. What are the things that you need to do, or the preventing factors that you are able to do? Some of them are strong self-esteem and confidence, strong family values. When you have the strong family values, you're able to have the values. For example, if you're taught about the different values when it comes to maybe Christianity, or not even religion related, but family values that you have. Then parents who monitor their children. I've been told to slow down because of the translator in Niger. That's why I'm slowing down. Sorry, I was quite fast for the Niger team. But yeah, protective factors, again, if you have parents who monitor their children, you're able to be monitored, you're able to, the parents know where you are at any given point. Then participating in co-curricular activities, when you have in drama festivals, in music, when you're a part of maybe the youth group in church, you're able to be involved in some of this. You're able to be busy so that you're able to prevent yourself from being idle, because, of course, when you're idle, you become the devil's workshop. So engaging yourself in co-curricular, then you have rules and expectations at home. Right now, you're in the university. Your family back at home are expecting you to have gone to the university, you're studying. There is a manner they expect you to behave. So you have that expectations that make you not to go into the way of drugs. Then you have positive relationship with your friends and family. Then you have friends who are not involved in drugs, and you're generally performing well in school. So those are some of the preventive factors. So I'd like to take it back to Jefflin, and now she'll finish the session, because now she's going to now explain to us how one becomes addicted, then what is the relationship between drug abuse and HIV and AIDS, and again, what mental health issues are there, because all these things are interrelated. So I'll give you her back, at least she'll take you through that, and then we shall be able to come back at the end of the session to continue. Thank you so much. Back to you, Jefflin.
Thank you, Ian. So as we had described earlier, addiction is a condition, it's a mental health illness, just like any other. But one doesn't wake up today and get addicted. So there are stages that comes with addiction. Number one, first stage is the experimental stage. Nothing happened. You're just chilling, just one day. Even for the addict, it's sad that they had their day, they had their first day. So it just happens, experimental stage. That time you just want to experiment, how does a drug feel? What do you feel when you take marijuana? What do you feel when you take alcohol? First stage, experimental. After experimental stage, there are ones that get excited with drugs. There are ones that don't get excited with drugs. Remember, we have different neurotransmitters in our brain that play different roles. One is dopamine neurotransmitter. Dopamine is a feel-good hormone. Ideally, it's supposed to make you feel good. So the drug, what a drug does, it mimics, it tries to copy this neurotransmitter. It tries to make you feel good. So when you continuously use the drug, the dopamine drug gets extinct. Your normal neurotransmitter gets finished and the drugs take over. So in absentia of the drug, you don't have excitement. That is why you hear people saying, if I've not had shisha, I'm so down. I don't do anything. I don't enjoy even sex. And you wonder, what is wrong with this person? It is because the dopamine, the feel-good hormones, they are many, they are GABA, the dopamine, because of no time will not mention. The drugs now took charge of your neurotransmitters. So the first stage, which is experimental, if ikikubamba ama isipokubamba, it excites you or doesn't excite you. If it doesn't excite you, you're lucky, you exit from addiction. The second one is social drinking. And we are all here, most of us are here. For any reason, you don't even explain why you drank yesterday, just because it was social. It was on a Saturday. I didn't have classes, just social. We ask you, why did you take the drug? You're like, imagine, I don't know. Jefflin, I don't know. Which, if you're not careful, it develops to the third stage, which now becomes an habit. You make it the habit of drinking. And most of our young people, have made it clearly a rule, a habit to take drugs, especially every Friday. I know there are people who are waiting for me to finish this talk for them waende form so that they can go. It's an habit. What else is it likely to happen? It's on a Friday. There's someone even in chat box ashambia mwenzake, it's on a Friday. It's an habit. For us, we don't struggle with these 3 stages for healthcare providers. We keep on giving guidance because you can change at given time. You can form a better habit. You can form a better social life. You cannot experiment. But now the 4th stages, that is where we come in. It is called the instrumental stage. Just like an instrument, just like a drum, you get cornered by a drug that for you to feel good, it has to use you as an instrument. So without a drug, you don't get excited. Without marijuana, you cannot read. Without alcohol, you're not likely to perform. And if you're in that stage, I would highly recommend for you to see us or just see any healthcare provider or visit us in our social handles and so that at least we can able to create a network where we can help you. And of course, the last stage is addiction. Now here you become a slave of drug and you're not able to do it. And it's sad. And just remember, as I said, every addict in Madare, in any rehab, they tell a story of one day. It was that day morning on my way to work when my friend... It's a very sad story. I listen to sad stories every day and they start with one day, as I was in second year, a friend introduced. So we are here today to say there is that day. Even experimental, the higher time you understand the effect of the drugs, please you are able to limit. So the 5 stages, as had mentioned earlier, experimental stage, social stage, habitual stage, instrumental stage, and lastly, addiction. People ask, what is the relation between HIV and drugs? And number 1, I'll say, when we are intoxicated, we tend to lose our judgment. Most of the time you realize that the things that you did when you were sober, you could not have done them. The things that you did when you were intoxicated, you could not have done them well sober. Most of the time they get lured, they get intoxicated, and they give in maybe to sexual intercourse with people. Remember the way I had said that they don't know about their status. The judgment becomes poor. There is a saying that comes like when you enter in a club, you're sober, you're a very serious man, very serious woman. You take 2 beers, everybody starts getting beautiful. Even all the waiters there starts getting beautiful. As you continue, you get lost in between. So, number 1, the judgment, and can lead you to those now unwanted behaviors. Number 2, for the abusers, the people who inject drugs. At times the urge is too much and they are broke, or they don't have time to look for the injection, the needles. Maybe they are likely to share. The urge is there. What do I do? Maybe I don't have money to buy. Maybe I don't get where I can buy. I have money, but I don't get. You inject. You give me the needle, the same needle. I inject. That's what happens. Another person asks, maybe I was born HIV positive and I'm intoxicated. I don't remember to get time to take my medication, or rather I forget. I pose danger to myself and the partner that I have, because now I'll have left the train of USU that I was talking about and join the high viremia people. So there is a very good and a clear indication that we can prove that there is a connection between drug and substance abuse and HIV. Lastly, what is it likely to happen if I get now abuse? What are rather the consequences? As put in our screen, different consequences can happen of substance abuse. Number one is deterioration of personal grooming and habits. You don't take a shower, or even if you do, not as regular as you used to do before. You get unkempt, you don't even comb your hair, you don't look decent. There is sudden aggressive behavior, or what we call the bizarre behavior. You start behaving differently. You can even start getting the psychotic symptoms, hallucinations, disturbances in your thought process, the thought content, the way you're saying, hallucination and illusions. There's increased risk of heart disease, not only heart disease, but rather physical health. You're likely to suffer from physical conditions. One could be cancer, one could be hypertension, one could be diabetes, and a lot more. Increased risk of contracting diseases, I'd say, like HIV. There's feeling anxious when not high. You're not likely to perform your daily duties, even school, even work. Why else would I go to work if I'm high anyway? You start asking your questions, such questions. Risky sexual behaviors. You are intoxicated to forget maybe to don in a condom, to have PrEP as your precautions. And of course, mental conditions. I'd said earlier, different drugs work differently in the brain. You're likely to get, and the sad state is that most of the mental conditions, the substance use disorders that are coming up are quite a lot among the young people. We have a lot of young people with substance use disorders, and clearly they are coming from the substances that we are using. We use them for fun, but remember, we could be predisposed. Like Ian said earlier, other predisposing factors would be genetical predisposition. Your family has someone who had mental health conditions and you're here taking marijuana, you're likely to predispose yourself faster. A question that I know will come in the chat box is, why would we use drug, the two of us, and one gets the mental condition and one doesn't? A lot of factors. Number one, social factors. They could be having social issues, social factors sorted. Another thing would be genetical predisposition. At their family, they don't have anyone predisposed to mental condition, to alcoholism. Alcoholism is a disorder. So you wonder, why is my friend getting affected? Why did I take my friend to a mental health hospital and I didn't? And you don't understand why. So there are different factors on how these things affect. We have life choices as we wind up. We have different life choices. The fact that you are in campus doesn't really mean you have to use drugs. Different people have different way of doing their things. You could engage in a busy schedule. You could choose a company that does not abuse drug. You could choose a partner maybe that doesn't abuse drug. You could get busy at work. It's your life choices. And we are here to make sure that we've empowered you those options so that when you go and use drug, at least you can remember all the consequences that you've talked about. And I think that is the end of our session. We will straight jump to the question and answer session so that at least we are able to respond to these questions if there are any in the chat box. From this side. Are there questions? Is there anyone who has raised their hand? Am I audible? I can't see any question in the chat box. Felix Omondi, you've raised your hand. You can go first. Felix Omondi, yes. Unmute yourself.
I was asking about genetic predisposition. So when somebody eats tobacco and get cancer, and another person uses tobacco and they don't get cancer, does genetic predisposition have anything to do with that?
Well, thank you for that, Felix. With genetic predisposition, remember also cancer is just an illness like mental condition, and you could be predisposed to cancer as well as mental condition. One thing with smoking, it's likely to affect maybe different part like the esophagus due to smoke. So you can get cancer maybe of the esophagus. So actually all conditions can be genetically predisposed. You can have different predisposition for different conditions. I hope I'm clear, Felix.
It's clear from our side.
Thank you, Felix. Someone else had their hand. Laikipia University, I don't know who was to respond. Laikipia University.
Okay, hello everyone, Ilja from Laikipia University. My question was, what's the difference between sniffing and snorting?
Sorry, we forgot to talk about different type of how drugs are abused. Sniffing is like, what is it called? I need local. For the Machakos County are likely to get it. Mbake, ile, putting it and it's like blowing in, getting it in. I'm really trying. And smoking is how you take the cigarette. But sniffing is a common one that you use to inhale. Yes. Inhaling the substance. You put it maybe here and you inhale. It's common, especially to the old grandmas. They like using it. They sniff it. For the ones that abuse heroin as well, you can see them putting it in a powder form and inhaling it like this. They are sniffing. I hope I'm clear.
We have another question from UN.
Okay.
Hi, my name is Betty.
Yes, Betty.
So, niko na swali. I have a question for those who smoke weed. Si mimi nauliza rafiki mahali.
It's okay.
So, I'm asking,
yes,
for those who smoke weed and hawana pesa za kwenda rehab or something, steps gani wanaweza chukua wakiwa labda kwao kwa nyumba au kwa hostels zenye zinaweza wafanya wa detox na like get through it bila kwenda rehab?
Okay, thank you. One thing about marijuana, it's like unlike alcohol, the withdrawal symptoms of marijuana, they are not so physical. If you're keen, you can manage them because they include things like headache, the urge. It's more of psychological withdrawal. So if you're really determined with marijuana, you can beat it. Unlike alcohol, for the ones who is addicted with alcohol, may need a clinical intervention because this is what they can develop in what we call delirium tremens, which is a psychiatric emergency and can lead to death. They can get tremors, they can get difficulty in breathing, hallucinogens, very severe withdrawals. So if you're struggling with marijuana and kabisa, you've really tried it yourself and it's not working, you can visit the health facilities around, or maybe a counselor that you know, so that at least they can help you walk through the journey, because it's more of psychosocial support and not really a clinical support. I hope I've helped. Thank you, Masu. Another question? Bomet is asking how to restore. Where is it gone? I can see the chat box. Okay. Bomet, from Bomet, how to restore a depleted dopamine caused by drug. The way it got extinct. Shit. We log out. The way it's okay, I can still get the question. The way it got extinct, the way the behavior started, that you just the dopamine were extinct in your brain, it is the same way you can start renaturing it with good positive coping mechanism. One would be an exercise, good diet, making healthy habits. Remember, if you remove the dopamine from the drugs from the body, the normal dopamine will start coming back again. It will start doing its function again. So that at least now you are able to redo the things that you didn't do and enjoy the things that you used to enjoy. Remember, neurotransmitters are different. It's not only dopamine. We have a lot of neurotransmitters. Maybe like serotonin, a bad hormone, that when you take drugs, you're likely to exacerbate it, and when you don't have it, auski vizuri. So if you find that you have alteration in your moods, it's high time, like now, I am getting affected and I need to do something about these conditions. Maybe seek a healthcare provider support, seek a counselor support, or even have a friend talk about it. If it's a lot, maybe refer you to a rehab or something. Yeah. So thank you for having me here. It was a very good session. I hope I've helped you in one way or the other. As I said earlier, we'll keep interacting more through the seals that you are. Thank you for the good job that you're doing. And you can follow us on different social handles, as I said. On TikTok, especially Vijana Tubonge Health, so that at least we are able to continue passing this knowledge. And also through the I Choose Life Africa handles, where we can refer, we can see you at personal level and do consultancy as we continue. Thank you and have a good evening.
Don't go. Thank you. I know you celebrated Jefflin so much. Thank you so much, Jefflin, for those sessions. You have.
Podcast Planet can mute.
Can you guys hear me now?
Yeah.
Okay, thank you. Thank you for celebrating Jefflin. She has done an amazing job. She's taken us through the sessions on HIV and STIs, and also on drug and substance abuse. Ladies and gentlemen, at this juncture, I'll kindly request every county officer to kindly check on their WhatsApp. I have shared a link on the session evaluation. And I'm also going to share the link with the team in Niger so that we can evaluate this session. Kindly, let's all participate. There are a set of questions that are there, and they are I'm also copying the link on the chat box. These questions or the tool is able to help us improve on the different aspects. So, ladies and gentlemen, kindly feel free to fill the forms. I know the different county officers are circulating the link in your in the different WhatsApp group. It will be very important for you to fill, because the link will help us evaluate the session so that we can improve. As we train you, it is for you to give us feedback on where we can improve, what we can do so that we can have a better session next time. So thank you so much. I've shared the link. It's the unwritten forms.office, but the different county officers kindly help me circulate that link in the student sales group. I have also posted that link in Laikipia University. I am sharing that link with Pastor Erastus immediately right now. I am doing it so that we can be able to get feedback on how we can improve on these sessions. So kindly, the different seals, help me fill that form. It will help us a lot. If you have any challenge, let me know. I have already shared the link with you so that you can be able to give us feedback. The link, it's on the chat box. Mr. Thomas, Mecha Daniel, I have shared the link with you so that you can be able to fill or evaluate the session. Kindly be very honest. Again, this is useful feedback for us. It will help us improve the sessions to come. And remember, we are all looking for the day that we are going to get commissioned. So stay tuned, attend all the sessions, participate, and for you, this program will make a difference in your lives. So kindly, let's do that. County officers, ensure we have the students fill the forms. Let them give us feedback on how to improve. And with that, ladies and gentlemen, I'll welcome Pastor Rastas and request you to pray after we are done. But before that, I'd like to invite Mike, our CEO, if you have any comment, just a parting shot or word of encouragement as we go through this journey. I welcome you to just encourage the different students in the university, and then I'll hand it over to Pastor Erastus. Pastor Erastus is the one with the students in Niger, and they speak French, so they are now my friends and friends of I Choose Life for many years. But now let me welcome Mike. Mike, kindly, you can come and give us your comments or parting shot. Then Pastor Erastus will pray and we shall end the session. Remember to do the evaluation as we do all this. Over to you, Mike.
Well, thank you so much, Jefflin. Wonderful job. You have an amazing skills in training young people. Today's session was around sexual and reproductive health, HIV prevention, drug and substance abuse, and you've done an amazing job. Thank you so much. Thank you, Ian, for doing a fantastic job of facilitation. And thank you for all the students from different universities. It is amazing to be able to interact across different counties, different universities, but also across countries. And so we're in the midst of developing our strategy for I Choose Life for the next 4 years, 2025 to 2028. And our slogan is empower, engage, and connect. And so we see our responsibilities as we think about this generation, our responsibility is to empower you as a young person, as a student, in areas of knowledge, attitude, and skills. It is to enable you to engage so that you are making a difference in your own community, in your own country, and then connect you to opportunities and resources. So that is what we are about. And as we work together, we hope to be able to create opportunities together. So with that, thank you so much, particularly for Neja. I know that language is not very easy. We're speaking in English, and yet you are having to internalize this in French. Thank you for Susan, working together with Erastus, Pastor Erastus. Thank you so much. And we really appreciate you. We hope someday we'll be able to connect face to face. So over to you, Pastor Erastus. You can actually say, you can just make some remarks and pray if you want. Thank you, and over to you.
Thank you very much, Mike, for inviting us to this. And I'm very sure that even as far as the transition is concerned, we are just going to become better and better as time goes by. We have enjoyed the session. We have enjoyed especially being connected with students from other universities, and we look forward to next week session. We do really appreciate. But because there could be one or two things we have missed because of the language, we are going to debrief a bit after this. But to punish you also, the prayer is going to be in French, so that you can also try to internalize in French. So we are going to pray in French. And
yeah.
the trust is for you to know, to decipher when to say amen.
All right.
Yeah. So everybody, let's pray.
Ok, nous sommes de la prière. Dieu Père, nous te disons merci infiniment pour ce moment précis. Seigneur, nous te disons merci pour ce que tu as fait au milieu de nous. Nous te remercions également, Seigneur, pour la formation, pour la session, Seigneur, que nous avions écoutée et suivie, Seigneur. Seigneur, nous te remercions également pour les deux, Seigneur, parmi là dont tu l'as utilisé pour nous transmettre le message, Seigneur. Comment nous avons protégé, comment nous avons gardé, Seigneur, de ces mauvaises pratiques qui corrompent les moments, qui corrompent le monde d'aujourd'hui. Seigneur, nous te disons merci. Merci parce que c'est un défi, un privilège, je peux dire, pour tout un chacun de nous de connaître comment il va se protéger sa vie, comment il va garder son corps. Comme dans ta parole, tu as dit, Seigneur, le fait que nous présentons devant toi et nous soyons pires et respectés, Seigneur, devant tout un chacun de nous, Seigneur, en préservant notre corps. Seigneur, nous te disons merci. Nous te remercions, Seigneur. La personne qui nous a enseigné, Seigneur, ouvre cette mentalité à lui et tu lui donnes une capacité intellectuelle, Seigneur, pour qu'il puisse donner et transmettre le message, Seigneur, sans cesse et partout dans le monde, pour que le monde bénéficie de ce qu'il a, avec sa sagesse, Seigneur, qu'il transmet à tous les étudiants, Seigneur, et à toute personne qui est là, Seigneur, en train de suivre ses cours et qui est en train de suivre ses sessions. Seigneur, nous te disons merci. Nous te disons merci. Et nous prions également, Seigneur, pour les restes des sessions qui se sont en cours. Seigneur, permettez-nous, Seigneur, de venir assister, Seigneur, dans ces sessions et pour que nous bénéficions, Seigneur, de ce que tu as préparé. Et Seigneur, nous te remercions. Nous te remercions. Et nous remercions également Dadi, celui qui nous a conduit à comprendre cela ou bien à découvrir cette session, Seigneur, aujourd'hui. Nous te remercions, Seigneur Jésus-Christ. Nous te disons merci, Seigneur. Continue à nous former parce que dans ta parole, tu nous as dit, c'est le Père qui guide les pères. Seigneur, laisse-nous
aiguisé entre nous, Seigneur. Jésus-Christ, toutes choses qui vont soulever et qui nous empêchent de comprendre et de lire ta parole, Seigneur. Nous les rabaissons au nom puissant de Jésus. Seigneur, nous te disons merci pour ce moment. Et au nom puissant de Jésus-Christ de Nazareth que nous avons prié.
Amen.
Amen.
Amen. Amen. We shall translate next week. We shall let you know what the prayer was about next week.
Merci. Merci beaucoup.
Yes.
Au revoir.
But thank you very much. Yes, merci beaucoup.
Thank you. Comment ça va? Comment ça va?
Yeah. Au revoir.
Yes, ça va bien. Ça va bien. Yeah.
Ça va bien.
Yeah. Bonne nuit. Bonne nuit.
Bonne nuit.
Good evening. Good evening.